Hey, if you're new here, my name is Bod. I'm currently a first year medical student studying in Japan in IUHW School of Medicine. Today, I'd like to talk specifically about pharmacology. Now, in first year, we study in trimesters. In the second trimester, we study the basic science subjects. So, in order, we studied histology, physiology, molecular biology, biochemistry, pharmacology, immunology, pathology, general pathology, embryology, and basic obstetrics, and lastly, infectious diseases, but it was mostly microbiology. Out of all those subjects, the two most difficult one, at least for me personally, was pharmacology and infectious diseases. The subject that I studied the most for, at least spent a lot of effort, was physiology and biochemistry. But at least in terms of difficulty, pharmacology and infectious disease for sure. And I believe my scores reflected on that. I don't know my scores for infectious yet, but pharmacology, it's certainly the worst compared to other subjects. So, pharmacology, essentially studying about drugs, medicine, and their effects and what they do, basically. We had three professors, and two of them teach mostly clinical pharmacology. So, for example, stuff like analgesics, anti-allergic drugs, anti-inflammatory drugs, addictive substances, digestive system drugs, general anesthetics, anticonvulsants. We also had anti-neoplastic agents, cardiovascular agents, antihypertensive drugs, renal agents, anti-transporter agents. And we had one professor who taught essentially like the science and technical aspects of pharmacology. So like pharmacokinetics, pharmacodynamics, about more of the chemistry side of it, and also some physiology side of it. I think the reason it was difficult was because of this. See, for biochemistry, pharmacology, and immunology, the exams for those three subjects were 1 week apart from each other. So what ended up happening was when we had lectures in class on pharmacology, I didn't really listen. I was studying biochemistry while we were having pharmacology lectures. And when I finished the biochem exam, I had 1 week left to prepare for the pharmacology exam. And during this 1 week, we were being taught a lot of immunology. Now, the problem is that I haven't started studying for pharmacology yet at that moment. So I ended up just not listening to immunology in class and focus on pharmacology. I mean, that strategy of sacrificing the lectures, maybe it wasn't a good idea, but I think if I were to go back in time, I think I'm not gonna change the way I studied. I guess with all the limited time we had, and time management was certainly difficult. At least for me, it was difficult, and I simply had no choice but to study that way, to just not focus on school lecture and rather just study for the exam. Because the pharmacology exam is I would say like the boss fight in front of me. Immunology is the next week after that. So I had to focus on pharmacology. We aren't really given like a set of questions to study, nor a question bank or anything like that. And especially for the clinical pharmacology part. So in the 1 week, I spent a couple days just going through the slides. And I wasn't really focused on memorizing, but rather just to understand and grasp the concept. So I blew through the slides, and then I spent also another few days making questions from. So I went through them again, but this time a little bit more slowly. So like in one slide, I would use the app called Notion, and I would use the toggle function. So you can write a question, toggle to see the answer. And like per slide, or per PowerPoint, I would make like 20 questions, give or take. So I made many questions, and my goal here was to export that out from Notion and put it into Anki. So now I have all the questions in Notion and also flashcards of them in Anki. There's a method to do this, and I think you can check online how to convert like Notion to Anki flashcards. So the reason I made two of them is because Notion is, if I'm like tired and I just want to passively study, which is not effective, but come on, like sometimes you're tired, you don't have time to, you can't just actively study 24/7. So I just want to passively read, then I'll use Notion. And if I want to actively memorize, I'll use Anki flashcards. And some questions are your basic flashcards, and others, I turn them into closed deletions. I think that's what they're called. Essentially, by the time I finished making all of that, I had like 2 days left before the exam, maybe 2 or 3 days. In these 2 days, I had to mush everything into my head. At first, it actually didn't felt that difficult. Just memorizing the drug names. Yeah, they were new to me. But memorizing them and memorizing what they do wasn't that difficult. The difficult part came when I had to memorize their effects, their side effects, and I guess the mechanisms of them. And you have so much drugs, and they all have so much side effects, and some of them overlap, while others don't. And it just gets so messy so quickly. I think if I could improve one thing, I should have spent more time to organize everything and classify it my own way, so it'll be a lot easier to memorize. But I didn't do that, possibly because I didn't have enough time. But yeah, that was one thing I could have done, and it would have made my life a lot easier, but I didn't do that. I essentially took all the questions I made and tried my hardest to just memorize them. Just mush them in my head. Now, I already understand the general concept, but the thing is that pharmacology, sometimes you can't really find flow in them. They're just like separate, you gotta memorize them separately. It's difficult to build flow or connection. Unlike physiology, I think, like you can figure out a flow and connection between all the information, but pharmacology, even infectious disease, it's more of like spots. Like, it's difficult to explain, but I spent those 2 days just torturing myself by doing Anki flashcards again and again and again and again. Doing Anki in my room, downstairs, in the toilet, in the bedroom while I was sleeping, and reading Notion again and again and again. And of course I did past papers, but I did past papers only like the last day before exam. To be honest with you, the past papers did help quite a lot. But man, like on the exam day, when I immediately opened the test paper, first page, I was already confused on the first page. The questions were quite similar to that of biochem. You're given like 5 statements, and you're supposed to choose the wrong one or choose the right one. Sometimes that's quite difficult. Like sometimes you read and then you feel like everything's right, or you read and then you feel like everything's wrong. They would change just the quite specific details to make it right or wrong. Essentially, I was struggling the first half of the test paper, but the second half I just blew through it pretty quickly. And I was actually really scared after the exam. The reason being is that I counted the number of questions I wasn't sure about. I wasn't sure that the answer would be right. And the number of questions I wasn't sure about was getting really close to the amount of questions you needed to fail that subject. In my school, you need to get a score above 60% to pass. And I forgot how many questions was in that exam, but let's say I needed to get 20 wrong to fail. For example, I kind of forgot, but let's say I needed 20 wrong to fail. During the pharmacology exam, I wasn't sure of about 15 or 16 questions, meaning I only had 4 left as protection. If I assume that I got the 16 unsure questions wrong, I only had 4 left before I failed. Something like that. So that's why I was rather scared. The other subjects though, my safety net is around 8 to 10 questions. But this is the first time it dropped down to less than 5. When I did finish the exam, Obviously, you would go discuss with your friends, and I got a few questions back. That did help, but man, I was rather scared of failing that. Of course, if I fail, I have Saishiken, I can retake the exam, but I mean, nobody wants that. And the worst part is that they took so long to tell us the results. So, yeah, that didn't help. To all the juniors that are studying pharmacology, or my go-highs that are gonna do it next year, if the system remains the same, I know you have your own different ways of studying, but I really do recommend, at least for pharmacology, to take your time to really organize everything, because that would have probably made the memorizing part a lot easier, because there is just so much info, so much overlapping, and so much detail as well, that if you don't organize, then you'd have to end up struggling like me, just trying to mush everything into your head. It just makes your life difficult. Maybe perhaps actually listen during the lectures. Try to focus on the lectures more. Try to listen in more rather than studying for other subjects while taking lecture on a different subject. So yeah, that was my experience pharmacology. I thought pharmacology would be easier than biochem, but that was not the case for me, at least. Yeah, good luck if you're also a medical student. I hope you do well in your exams. Thank you.